Good evening, our viewers. Welcome to the very first episode of Doctor's Call with me, Gladys Mbua. And today we want to talk about an issue that is very serious but less talked about, and that is mental health. And with me, I'm joined with a very lovely lady who will help us understand this topic a lot better.
Hello, my name is Yvonne Kiogora. I am a clinical and public health specialist, and I am also a mental health literacy advocate.
Okay. And to start us off, Yvonne, what is mental health?
Well, mental health is a state of mind whereby an individual is able to know about his potential and use it up to cope up with life stresses.
And is there a difference between mental health and mental health well-being?
Mental health is a state, as I said, of the person. Mental health well-being is whereby the mental health status of a person is doing well. For example, let's say talk about this. A person might have the mental health. It's something inside. It's a common thing. It's like having physical health. Like your heart is pumping every day, but at times your heart may not pump as expected or desired. So mental well-being is whereby like your mind is working as it should.
Okay.
Yes.
Why mental health? Why should we talk about mental health?
Mental health is one of those topics that I like talking a lot, every time, everywhere. The why is because mental health is part of us and we are part of mental health. We can never separate mental health from anybody. Each one of us has our mental health. The status we are to know. And you find mental health is something that you cannot see. The only time you can see mental health, probably in extreme cases, when someone has mental health illnesses like psychosis and probably something like schizophrenia, which are the conditions that we'll discuss as we go on. And for example, I like talking about, I work with patients. So if a patient came and has a bleeding arm, people will of course run and say it's an emergency because we can see it. But if a person is seated somewhere and is having a suicide ideation, we will not tell. They're just silent and seated. That's why we have to talk about mental health so people can understand what it is, what you can do, and where you can get your help from.
Okay. So, in relation to that, I have a question.
Definitely.
Is there a relation between happiness and mental health?
Yes. All right. We even have a happiness score, and of course, Kenya, we're not the happiest, and we've never done a happiness survey. But in developed countries, they do have a happiness score, and the happiness score, you find that people are happy due to various factors, and in mental health, the level of happiness actually relates to the level of mental health well-being. In a depressed society, for example, lack of proper resources and like basic things like shelter, like food and clothing, you find that their happiness level is low, and they are actually at risk of developing various mental health illnesses. This has been seen in instances where we have in our setup Kenya, we've seen that people like internally displaced persons. We've seen that these in refugees. A lot of studies have been done to ascertain their level of mental health status. Not because there's something wrong with them, it's because of their circumstances that predispose them to issues with mental health illnesses.
But then again, based on the issues and factors we have socio-economically, including poverty, unemployment, is it really possible to be happy, or happiness is a state of the mind?
Happiness, the state of the mind, is true. Another thing is that happiness, it depends on a person. I might not have a meal today, but I am happy. I might have a very big car, very big home, but I am unhappy. So you find that happiness is one way, let's say inversely proportional. For example, you can be happy, but the physical things are not working out. So happiness is actually, let me say, part of mental health. Maybe you can ask the question again.
Okay. So what is the state of mental health in Kenya?
Well, mental health in Kenya, let's start and talk about, let's say it's poorly managed, but over the years, Overall, healthcare in Kenya has improved, but mental health has lagged behind. As I said, why mental health? It's unseen. We have programs for hypertension, programs for HIV, TB, and even the parasitic worms. But when it comes to mental health, people assume it will be fine. And when you look at the hospitals that provide mental health care, especially the government hospitals, sparingly 0.7% of all the hospitals actually have a mental health professional. The number of psychiatrists has been going up, but not enough to cater for the population. And the other thing about mental health, we find we have the various professions. Not many people are even training it. We don't know whether it's the funding, it's the interest, but we always are trying to mobilize people to do more mental health courses because we need more mental health practitioners in the country.
Do you think when creating frameworks and policies, caregivers and also the patients should be involved in the process?
All right, Gladys, that's a good question. You find that everything lies on the decisions we make. And the decisions that we make as a country are based on our policies on how we are going to do things. You find that the policy makers, of course, are the people in the government, the NGOs, the other stakeholders. They all make very good policies and maybe also recommendations on how we handle mental health. Caregivers and the patients are part of the management, and there's something that I'm actually working on that makes me excited when I hear about policies, because we are trying to engage even the person receiving the services, and this involves the caregivers and the patient. We've done all this. We get the policies from previously done researches which have proved to be beneficial. And as going forward, we are engaging more patients and caregivers in the amendments of the current policies, although not sure how far it has gone, but we hope that whatever is being drafted is going to be beneficial for everyone.
Okay.
Yes.
You haven't talked about funding. What is funding like?
Funding. Let me come back home. This is Kenya, this is Africa. WHO recommends that we fund health at least 15% of the budget. We recently had our budget, and of course 15% didn't make up that budget goes to health, and mental health gets funded from that budget. We don't even have a separate budget for mental health, which is supposed to be there. So the thing that mental health gets is 0.01% of the government budget. You can see even our own government does not prioritize mental health. And we said that mental health is in us. Anybody can suffer from mental health illness irrespective of where they are. Financially, social status, we all need proper mental health care. In fact, let's not just talk about mental health care, we talk about proper mental health care. And proper mental health care ensures that we as a people, when we have the need, we have professional people to handle it. Medications, if needed, are available, and there is no stigma in accessing the health service.
Okay. Insurance. Does insurance cover for mental health?
We are fortunate that we live in a world whereby people fought for better working systems in the government. Our national insurer, that is NHIF, does cover for mental health services, even rehabilitation, in some selected facilities that they have agreements with. And so I always encourage anybody I meet, I ask, do you have an HIF card? Do you pay for your health services? How do you do it? Even as much as outpatient is not being catered for, mental health is part of it, and it will go a long way to help each and every one of us. Yes.
Yes, our viewer, you heard it right here. When we are going for a short commercial break, when we come back, we're going to focus more on mental health care. greatest investment of our lives is health. So join me, Gladys Mumbua, every Saturday at 2:30 p.m. on Doctor's Call, where we get tips and knowledge on how to expand this vast investment. Welcome back, our viewers. Remember, you can follow this conversation on our social media platforms, Facebook and Instagram, Riverside TV KE, and you can subscribe to our YouTube channel, Riverside TV Kenya. Yeah, we were talking about mental health. Now we're back to the mental health care. How is mental health detected?
Well, to start with, as unseen as it is, we still have people and means of diagnosing mental health illnesses. And diagnosis is always done by an authorized mental health professional. We have classes of health professionals. Of course, the one we know most is the psychiatrist, the psychologist. We've got mental health nurses, mental health clinical officers, community mental health workers. In the diagnosis, in our setup, people normally go to the nearest hospital that they can find or healthcare environment. Mm-hmm. And when they go here, the person attending to them has been trained to know a few conditions. And if the case needs more probing, then you are referred to a mental health specialist. Around us, the one that you know most is
Mathare Mental
Exactly. And whenever you mention Mathare, there's stigma to it. So we are working on how to destigmatize anything to mention mental health. So when a person has any, these conditions, they are diverse. You might think that you have one condition and maybe you have another one. People like going to Dr. Google, and Dr. Google clearly will mislead you. And that's why you normally tell people, go to an authorized healthcare provider if you have any questions. And when you go there, they will tell you what's going on. Sometimes it could be just normal stress and nothing major. Sometimes after some probing, they might require to refer you. In this referral system, of course, it's not a diagnosis that people like associating themselves with. In the diagnosis, the person who's diagnosing you, of course, a professional, will see the need to either put you on medication or give you some sessions for psychotherapy, depending on the diagnosis. And when this has been done, let's remember, mental health care can go for a very long time. For example, like something like depression. Depression can go as long as 9 months to 2 years to 3 years. So it's not something that you go like Panadol, I have a headache, I pop a Panadol and I'm well. Mm-hmm. Mental health care can take a while. So it's always wise to advise the client, this and this condition has been found. And we'll need to review you for some time, for some months. Because if you tell the client this, they'll ask you more questions. How am I going to manage it? And of course, people are normally worried about cost implications. So we need also to make our mental health services affordable for our clients. That includes the medications and also the consultations. Maybe in public hospitals, it's cheaper, but in the private sector, it gets a bit pricey. And that's why even the access of mental health in the community is actually poor.
Okay.
Yes.
How can a client or patient cope with mental health?
Well, coping is a way of adapting to change. And different people adapt to changes differently. Just because you can't cope up maybe with a heartbreak doesn't mean you have a mental health issue. It means you have a different coping mechanism. And when it comes to mental health, one thing that a client is told that they have the power to change their circumstances, especially in psychotherapy, Another one is told that you'll have to be on medication, not because you cannot handle it, but because you have some chemical imbalances that can only be managed through the drugs that you've been given. So a client might need to go for some counseling sessions, and if they'd like to, they can call the next of kin or the person whom they confide in. Sometimes if the person maybe can cater for their health services or is independent, in lack of a better word, they might opt to keep the illness private. But every time they are encouraged to have a person whom they can talk to, because mental health, as you know, it is something that you need to relate to people. Because when you have good mental health, you're able to relate well to people, to cope up with situations, you're more productive. So there are a lot of social factors that actually affect a person when they are going through a mental health illness. So it is wise that a client is given the proper knowledge on how to deal with it. And as I said, the option and the care is normally on the patient's hand. They are trained on how they can better it and how they can improve and be productive in the community.
Okay.
Yes.
And mental health care, how can we boost mental health care to better it?
Well, boosting. Let's go back to what I liked talking about. The way to boost mental health care is, one, people to know that mental health is an illness like any other illness, that is physical illness. People to accept that when you have an issue, please seek proper health care. In Africa, not in Kenya specifically, people seek health care from various means, including medias, including oracles, traditional herbalists. But let's remember, it's a state of the mind and it can get better. When you think about children, when they are born, when you see a newborn baby, you can't tell this baby has a mental health condition. I've never even seen one in an infant. But as a child is growing, you depend on the environment, and depending on how they are, maybe in their bodies, because there are some which are actually genetically inherited. They might change. So you might notice these changes in a young child and maybe even an adolescent. And the other thing about these mental health issues is that in the community we are having a lot of NGOs who are trying to talk about the literacy, about the conditions, about the need to know about them and where to go for health care. The government has tried to bring more professionals in the field, but still there is a huge gap. We have a lot of counseling psychologists, and let's forget that we have a lot of unemployment in the country, and most counselors are jobless. I normally ask myself, how can we integrate them so that they can go in the community and help us improve the literacy levels when it comes to mental health? The private sector has done a good job. Apart from the major private hospitals, we have now private hospitals that are just cater for mental health patients. And apart from that, we need a kitty for mental health. Mental health to fund, we have trained health professionals. We need mental health now to maybe bring more facilities, maybe a fund that can be catering for mental health conditions. Because as you look at it, yes, we have the NHIF, it will cater for the outpatient and also for the mental health cases. But these things are only in the urban sector. When you go to the rural areas, I don't know how much mental health is being practiced when it comes to healthcare. So as the talks that we're having today, the talks that other people are doing, other people are also doing, they're the ones that are enhancing the knowledge and the need for, it's like a revolution in mental health. But I am glad that things are happening.
Okay.
Yes.
Now, based on your experience in the field of mental health, would you recommend it to be considered to be an emergency compared like all other illnesses that are considered to be emergencies?
Okay. Regarding that, since the pandemic, we've had a lot of social cases, gender-based violence. We've got a lot of suicides. Mental health cases have always been there. I'd like to take you back at when do people start experiencing mental health issues? I talk about mental health in adolescence because that is the age where most of these conditions come up. And this is the group that people don't even think are unwell. People will say that person is unruly. People will say that person is just pretending, maybe it's just adolescent and puberty will go away. And what people fail to understand is, if they evaluate, probably they will find that maybe this person has a mental health illness, and they're trying to seek help in the way that maybe attention seeking. Let's start with our young people, our adolescents, evaluations. Apart from that, as an emergency, of course, we can always call mental health an emergency. So what are you going to do about it? You call it, if something is an emergency, we have to stop everything we are doing and attend to an emergency. I've worked in the clinical setup for a very long time. So when it's an emergency, all other services are put on a hold. And if we're to declare mental health an emergency, what are we willing to put on a hold so that we can sort it out? If we declare it an emergency, then let's do something about it. Yeah.
Now, what would you recommend to the government when it comes to mental health?
My 5 seconds of fame.
Yes.
So what my recommendation would be, we need more mental health practitioners in the field. We need integration of mental health services. I can see they've tried with the schools, because back when I was young, we didn't have counselors. When I talk to the young people, we have school counselors. That is a plus. We need affordable medications for mental health. We need proper facilities, because sometimes someone might need to be in a situation, in a safe space. We don't have enough safe spaces for mental health. And the way, how we talk about politics in our country, that we love it. Let's prioritize health. Let's prioritize issues to do with economic development. Because, you see, when someone is going through a struggle, basically they should find a way to help themselves. But if you are unwell, even the simplest of tasks you will not accomplish. So as I said, we need a revolution in the healthcare system and a focus on mental health.
Okay.
Yes.
So finally, we've talked about stigma. What would you tell someone who thinks they have a mental issue but they are afraid to address it because of stigma?
Well, to start with, one thing to think you have a mental illness, well, you can think about a lot of things. We are allowed to think. But as a person, if you're going through something that you cannot tell anyone, you cannot explain it, we'll have more sessions on mental health so that you can understand some of these things that people go through and they're unable to handle it. Go to an authorized health professional and state the issues you have. And I am hoping that whenever you go, don't go to a chemist. Go to a place where you'll be consulted and someone will listen to you. And when they see that you do actually need to be treated or referred to a mental health professional, they will do so. Do not self-diagnose. Self-diagnosis does not count in medicine. Someone who's trained and actually is trained to take care of you will take care of you.
Okay. Yes. Our viewers, thank you for joining us today on this episode. I hope that you have learned more about mental health. Stay tuned for more episodes where we explain the different types of mental illnesses better. Remember, in case you missed this conversation, you can catch it on our social media platforms, Facebook, Riverside TV KE, or on our YouTube page, Riverside TV Kenya. Until next time, bye.